Hello, Professor Blume and classmates. My name is Vickie Zhang. My topic is oppositional defiant disorder. What I will cover in my presentation includes multiple characteristics of ODD, details of its defining factors, the history of ODD, and the prevalence of ODD. At the end of my presentation, I will share examples of research-based instructional strategies to support inclusive practices and helpful suggestions for parents at home and teachers in the classroom. Doctor Douglas A. Riley, in his book The Defiant Child, gave the phrase oppositional defiant spectrum instead of ODD. His reason was that every child and teenager display the oppositional defiant behavior at some point. Some displayed the behaviors more frequently and intensely. Some got in trouble with authority figures. He considered the root of this type of defiant behavior to be the child or teenager's exaggerated attempt to prove to you that you didn't have any power over them. He thought ODD was not a mental illness in the same way as schizophrenia, depression, personality disorder, or conduct disorder. There is no psychiatric prescription just for ODD. A defiant child wants to keep doing what he does by ignoring you, not following instructions, or openly being disrespectful. However, an oppositional child can be bright, creative, and vigorous. This part of the characteristics can be a strength for the child's future success. With the right types of help, a defiant child can change his oppositional behavior with the joint effort of secure attachment, quality parenting, skillful teachers, a good fit of therapy sessions between a therapist and a child, and school-wide interventions. According to Professor Burgeon's textbook, Chapter 6, temperament refers to individual differences children have in the intensity and pattern of their reactions to their environment. Temperament is considered a collection of psychological traits such as disobedient and physiological traits such as activity level that have a genetic basis, are present early in life, and predict a later personality. Still, they are not necessarily highly heritable or stable. The traits that appear in children with ODD include a lack of effortful control, negative emotionality, and uninhibited behavior. A lack of effortful control means the inability to control impulses, follow instructions, and resist distractions. Negative emotionality refers to how easily children become irritated, angry, or scared, how intense the emotions are, and how well they control the emotions. Children with uninhibited behavior tend to be bold and embrace novelty. In addition, personality refers to enduring behavior and traits that can be thought of as a hierarchy. Temperament and attachment form the foundation for specific personality traits. Under control personality type with neurotic personality trait means the child is low in agreeableness and conscientiousness. The child can be restless, antisocial, impulsive, and unable to concentrate. Personality predicts whether learners have social success or behavioral problems. Under-controlled children with the neurotic trait are likely to have greater externalizing symptoms years later in adolescence. The history of oppositional disorder first appeared in Diagnostic and Statistical Manual of Mental Disorders (DSM), third edition in 1980, and later the ODD replaced OD in the revised edition of DSM in 1987. According to National Library of Medicine (NLM), the online article from NLM stated that ODD was not personality disorder. Although both had similarities, the article concluded The validity of ODD still needed further research. According to Boston Children's Hospital, ODD is one of the commonly diagnosed disruptive behaviors in children and adolescents, and with the right care, it can be treated with a great degree of success. Particularly in the 1980s and 1990s, psychologists found out what made ODD complicated was that it often co-occurred with ADHD and depression. Today, researchers actively explore the complex relationships and risk factors among ODD, ADHD, and depression. The original article's functional outcomes of child and adolescent ODD symptoms in young adult men and lifetime prevalence, correlates and persistence of ODD, results from the National Comorbidity Survey replication. Evidence suggests that prevalence rates of ODD are stable into late adolescence. Trajectories of symptoms persist in young adulthood. The results of ODD symptoms from childhood through adolescence predicts poorer age 24 functioning with peers, poorer romantic relationships, a poorer paternal relationship, and having nobody who will provide a recommendation for a job. The prevalence rates of ODD mean that parents, educators, therapists, and policymakers need to join forces to give the children diagnosed and treated as early as possible. I will talk about evidence-based strategies for ODD in school settings. The strategies I present here are from NSW Australian Government Education website. There are 4 areas with specific points. The areas include build a student's skill set, provide a positive environment, be proactive, and collaborate with parents or carers. I listed some of the points in the table under each area. For example, consider explicitly teaching social skills, such as how to share, apologize, grieve with others, and have a conversation. Connect with students and help them manage their emotions by talking about feelings, teaching calming down exercises, giving them a break, and explaining how the brains shut down when they become emotional. Provide effective feedback and rewards for positive behaviors. Give clear and simple classroom expectations and consequences at the beginning of a school year. Plan lessons and teach cooperative behaviors. Involve parents with homework assistance. Encourage positive behaviors at home and send positive notes home. To wrap up my presentation on ODD, I give 2 websites brief summaries for parents at home and 2 websites short descriptions for teachers in the classroom. For parents, the website suggests that parents look at challenging behaviors as the child is having a hard time, lacking the skills to do well, and reflect on why the child is showing the behaviors. Parents should model prosocial and self-regulation to increase positive behaviors in both them and the child. They should spend quality time with the ODD child because a positive and supportive parent-child relationship is critical. For teachers, the 2 websites introduce curriculum considerations in various subjects for students who become disruptive in class when finding a task difficult. This is the moment to help the students build their problem-solving skills. Children with ODD are less likely to be disruptive when there's a visual schedule and routine with any changes notified ahead of time. When ODD students show challenging behaviors toward others, they might try to communicate an unmet need, and the teacher can use the ABC approach. A is for antecedents, B is for behavior, C is for consequence, and coach them in social skills. Additionally, teachers should keep a positive tone to their voices and natural body languages. ODD students work better with positive reinforcement and have a safe place to calm down for rethinking their choices. Slides 11 and 12 are the reference for my presentation. Thank you so much for listening. Presentation is for Professor Blume's EDU 5640 course for Hope International University.